Now we are going to talk about the functional groups of nutritional ergogenics, and these include the anabolics, the fat reducers, the anticatabolics, the vitamins, and the minerals. The anabolic agent is a substance that enhances the body's ability to build tissues. Anabolic means building tissues. They lead to an increase in the muscle mass by promoting the protein synthesis. These include the chromium picolinate, the creatine monohydrate, the conjugated linoleic acid, the vanadilyl sulfate, the beta-hydroxy-beta-methyl butyrate, also the power protein bars, and the octacosanol. The mode of action differs from one supplement to another. Some increase the ability of the body to mobilize and utilize the body's ability to produce energy. Some decrease the appetite, which lowers daily caloric intake, and some block the absorption of fat. The anabolic agents include the chromium picolinate, and its claimed action is enhancing the action of the insulin and increasing the muscle mass. There are certain concerns and comments towards this chromium picolinate. We should know that sufficient amounts can be consumed in the daily diet, so there is no need to intake it if it is available in the daily diet. Another anabolic agent is the creatine monohydrate that increases the output activity in events which range from 6 seconds up till 4 minutes. The long-term effects are unknown for above 5 years. The third one, which is very interesting, is the conjugated linoleic acid. It enhances the response to tissue growth factors, hormones, and it increases the muscle mass. Animal studies as regards the conjugated linoleic acids are safe, but the long-term effects are still unknown if they are used for more than 5 years. The vanadilyl sulfate is a growth factor, and animal studies showed severe side effects while the human studies are less clear. The HMB prevents the protein breakdown and enhances the synthesis. It increases the synthesis and improves the body composition. And again, the long-term effects are unknown if it is more than 5 years, and the benefit seems to decline with continued use. The protein power bars increase the strength and aids in muscle development. The protein power bars are effective for the protein deficient athletes. The octacosanol improves the neural functioning, increasing the ability to utilize the muscle and intensity training. It has been used in food since 1950, and it seemed to be safe. What about the creatine? The creatine is not prohibited, and it is shown to be effective at improving training and performance of short-duration, high-intensity exercise. So, the creatine is considered to be a naturally occurring substance that is derived from 3 amino acids, and these are the methionine, the glycine, and the arginine. So, approximately 95% is stored in the skeletal muscle, and the remaining is stored in the brain, the testes, and the kidneys. The creatine in the skeletal muscle is in the form 65% of the creatine in the skeletal muscle is in the form of phosphocreatine. What are the side effects of acute creatine ingestion? If there is a sudden increase in the intake of the creatine, there might be some side effects, and these include the weight gain, the reduced joint mobility and muscle cramping, the nausea, and the gastrointestinal upset. There is a note of importance here. The potential long-term consequences of creatine supplementation are unknown, and the American College of Sports Medicine recommends it be used only by physically mature, well-developed athletes and not by adolescent athletes. Therefore, it's not recommended for adolescent athletes. The ergogenic aids that reduce fat include the caffeine, the L-carnitine, the chitosan, the DHEA, and the ephedrine. So these are a group of ergogenic aids that help in the reduction of the fat. So how does the caffeine work? It stimulates the CNS and also it stimulates the lipolysis. But at the same time, it may elevate the blood pressure, increase the heart rate, and can cause loose bowel and gastric upset in some persons. We all understand not all persons or not all athletes respond the same. So we have to take care of the side effects of the increase in the use of the caffeine. The second ergogenic aid that reduces the fat is the L-carnitine. The L-carnitine transfers the fat to the mitochondria and releases energy, and it also helps in the fat oxidation. It appears to be safe, and there is ongoing research on this L-carnitine. The chitosan decreases the dietary fat absorption across the intestinal lining. The chitosan decreases the dietary fat absorption across the intestinal lining. But at the same time, it can cause unpleasant events. It can cause diarrhea and decrease the absorption of fat-soluble vitamins. We come now to some other ergogenic drugs that reduce the fat, like the chromium. It increases the insulin action, increases the insulin sensitivity, it increases the muscle mass, and it also increases the basal metabolic rate. But there are concerns about the increase of the use of the chromium in some persons because it might result in the affection of the kidney, or it might result in the muscle wasting at very high doses. There is the ephedrine, which we all know that increases the lipolysis and the basal metabolic rate, but at the same time, it suppresses hunger. It is no longer sold due to the reported adverse effects. The DHEA or the DHEA increases the testosterone, increases the muscle mass and the basal metabolic rate. But in females, it can increase the testosterone level and it can increase the rate of heart diseases. There is an ergogenic aid that reduces the fat, is known as the YOMPI. This blocks the receptors inhibiting lipolysis and it increases the fat loss. But at the same time, the reported side effects include the anxiety, the nausea, the tremors. The purity of the supplements are of concern. Sometimes there are certain supplements which are not very pure and they may cause many side effects. I have to give you a note about the carnitine. The carnitine is found in the skeletal and the cardiac muscle, and it is ingested mainly through the meat, the fish, the poultry, and some dairy. Vegetarians have lower muscle carnitine stores. During intense exercise, carnitine plays a role in the metabolism of carbohydrates and the oxidation of the long-chain fatty acids. The carnitine may enhance performance by sparing the glycogen at the lower exercise intensities, along with improving the efficiency of the Krebs cycle at higher intensities. So carnitine is very important in this aspect. Now we can talk about the caffeine. The caffeine improves the exercise capacity in 3 modes of exercise. The prolonged exercise, which takes about 90 minutes. The sustained high intensity exercise, which lasts from 20 to 60 minutes, and also in the short duration exercise, which lasts about 1 to 5 minutes. Caffeine is known to delay the fatigue. And the ergogenic effect of caffeine is when using it 1 to 3 milligrams per kilogram body weight. But it is not recommended to take it in more than 200 milligrams total per day. there are a wide caffeine complex range of actions. Caffeine may stimulate the adrenaline release. Caffeine may increase the cardiac muscle inotropy, may increase the skeletal muscle contractility, may decrease perceived effort and fatigue, and at the same time, it spares the glycogen and mobilizing fat, improving the performance near to 30 kilometers mark in marathons. So people in marathon may take the caffeine because they improve their performance till up to 30 kilometers during the marathons. Thank you very much.